Okay, the next thing I'm going to talk about is one of the big dysfunctions I see in clients' squat patterns. It's going to be very common, so a lot of trainers are missing their clients doing this. They're not paying close enough attention, or they're not getting at the right angle to be able to see this, or they see this and they're really not sure what to do. So it's when the pelvis shifts laterally during the bottom of the squat pattern. It can even start to happen at the top as well, but more frequently it happens at the bottom. So what this looks like is if you have your client squatting, they're going down, and then right at the bottom you see a little bit of a hip shift to the side. So go down and a shift. Now sometimes it's not going to be as obvious as I'm making it there. A lot of times it can be a little bit more subtle. So when you're watching your client squat, you want to get behind them, get down into kind of a squat yourself so you can see them head on and look at their PSIS to see if you're getting that shift. If you're having a hard time seeing this, you can actually go and palpate your client's PSIS and look at that while they perform a squat movement to see if they're getting a lateral shift. If this is happening, you have to assess to see what imbalances are causing this. There can be lots of different things. One of the most frequent ones is an asymmetry in anterior pelvic tilt. So you'll see a 2 degrees or more difference between one side of the pelvis to the other when you're looking at anterior tilt from the PSIS to the ASIS. And usually there's a host of different muscle imbalances that go along with this. So again, you want to assess to see why those imbalances are there, why that dysfunction is happening in the movement pattern, so you can start to come up with corrective exercises to correct that. So you can start to have your client squat and have them not with an increased risk of injury. Again, it's more likely to have disc herniation, problems with SI joint, or increased lower back, or a lot of times anterior knee pain when the client is having that happen because of the imbalances that are creating the dysfunction. So with that, if you see a client who's having that shift, at the bare minimum what you should do is limit the range of motion, so you stop them before they have that shift. For a lot of clients, this might have them with a very, very shallow depth for their squat, so you want to correct this imbalance pretty quickly so you can get them back to squatting a healthy range of motion. Or the other thing that I'll usually do is just have the client focus on one-legged versions of exercises, so split squats, lunges, these types of movement patterns.